Hello, everyone. My name is Liliana Silva. I'm a certified rehabilitation registered nurse from Portugal, and I'm presenting a case study entitled Home-Based Pulmonary Rehabilitation in Chronic Obstructive Lung Disease. Pulmonary rehabilitation is the most cost-effective non-pharmacological treatment for COPD, with physical exercise and health education focused on the development of self-care and self-management, promoting physical, emotional condition, adherence to the therapeutic regime, and quality of life. In Portugal, only 2% of COPD patients have access to PR. Improving the access of PR seems to be necessary given the limitations both in creation of services and resources in this purpose and the adherence. PR can be performed in several settings, including the patient home, with home-based pulmonary rehabilitation programs shown to be as effective as hospital programs, once provided the equivalent intensity. This study aims to describe the effectiveness of an 8-week home-based pulmonary rehabilitation program in the COPD patient. This is a case study based on the care guidelines with a quantitative approach in which pulmonary rehabilitation program was applied for 8 weeks, focused on aerobic and strength training, education and telephone monitoring. Assessments were made at the time of admission and discharge using the clinical COPD questionnaire instruments, the 1-minute sit-to-stand test, and the Bartel index. The pulmonary rehabilitation program lasts 8 years, with biweekly sessions and telephone follow-up whenever necessary to support the patient and the family. During training, vital signs and a modified Borg scale were evaluated. So we have a 70-year-old male. He has been diagnosed with COPD emphysema for about 10 years. At this time, with gold 3D classification and dynamic hyperinflation. He had several exacerbations over the years, 4 of which require hospitalization, 2 of which occurred in the last year. Heavy smoking history till 4 years ago. He has class 2 heart failure, peripheral oxygen saturation of 94% in ambient air, FeV1 of 40%, presents functional dyspnea, score 4 in the modified MRC scale, score 4.5 on the clinical COPD questionnaire, indicating poor health. In his daily routine, the patient just gets out of bed to go to the toilet and have one of the daily meals, usually lunch, with his family in the kitchen. The remaining meals are taken in the room with the help of informal caregivers. He lives on the first floor without an elevator, which enables him to leave the house without the support of the firefighters to travel to the hospital, given his physical deconditioning. The implementation of a training protocol allowed the patient to improve his functional capacity and consequently resolve the altered nursing diagnosis. Based on the outlined rehabilitation plan, it was possible to obtain health gains that were sensitive to rehabilitation nursing care. He started to get up daily in the morning and performs the prescribed exercises daily, with walks inside the house. Once a week, he performs the strength exercises alone, meeting the limitations according to the modified Borg scale, and goes up and downstairs to the entrance of the house, have all meals in the kitchen together with his family. The values of CCQ showed an evident improvement in the patient health status, especially the improvement in limitation with activities that require moderate and intense effort. The sit-to-stand test showed shows a functional improvement with clinical significance. The Bartle Index assesses autonomy in activities of daily living. The obtained results after the implementation of this home-based pulmonary rehabilitation program are in line with the most recent scientific evidence and suggest an alternative to pulmonary rehabilitation programs in specialized centers. Thank you for just watching this presentation.